Welcome to Smart DX Media. Before I start, I will urge us to subscribe, hit the notification bell so that each time we release new hair tips, you'll be getting notification from us. And what we'll be discussing today is oral health and how it affects our general well-being. Oral health is more than a beautiful smile. It means having healthier well-being. This lecture will be divided into two forms. The first part, I will be discussing with us on general oral health, and the second part, I'll be discussing how oral health can cause systemic disease. And my flow for the first part will be: what is the meaning of oral health? Who defines oral health? What are the importance of oral health? Tooth cleaning and decay, sources of problem in oral health, preventive care in oral health, beneficial and harmful foods, mouthwashes, appliance care, education. After this, we will proceed to the second step. But before I do that, I will employ us to subscribe, hit the notification bell and share. The second part of this lecture will be sharing with us on how oral hygiene. Several studies have been conducted and it shows that oral health is a risk factor for a lot of systemic disease, which include cardiovascular disease, bacterial pneumonia, low birth weight or extreme high birth weight of one's baby, diabetes complication and osteoporosis, etc. Oral health refers to the health of the teeth, gums, and the entire oral-facial system that allow us to smile, speak, and chew. Some of the most common diseases that impact our oral health include cavities, which also known as tooth decay, gum, periodontal disease, and oral cancer. WHO definition of dental health. Oral health is essential to general health and quality of life. It is a state of being free from mouth and facial pain, oral and throat cancer, oral infection and sores, or periodontal disease, also known as gum disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual capacity in biting, chewing, smiling, speaking, and psychosocial well-being, based on WHO definition in 2012. Oral hygiene is the practice of keeping one's mouth clean and free of disease and other problems by regular brushing of the teeth and cleaning between the teeth. It's important that oral hygiene be carried out on a regular basis to enable prevention of dental disease and bad breath. Oral health is a multifaceted and includes the ability to speak, smell, smile, taste, touch, chew, swallow, and convey a range of emotion through facial expressions with the confidence and without pain or discomfort, and disease of the craniofacial complex, that is the head, face, and oral cavity. The map depicts the epidemiology of oral care or oral health generally, which shows the decayed, missing, and failed permanent teeth. It ranges from very low area to places where there is no data. However, the designation employed and the presentation of material on this map do not imply the expression of any opinion whatsoever on the part of the WHO concerning the legal status of any country, territory, city, or area of its authority, or concerning the limitation of the frontier or boundaries. Dashed line represent approximate border lines for which there may not be full agreement. Kindly do subscribe and hit the notification bell. Thank you. Kindly do subscribe and hit the notification bell. Thank you. The aim of this video is to explain how poor oral health is linked to a number of general health conditions and why mouth care really does matters to us as people. Good oral health is very important to be able to eat and drink comfortably, to speak and smile with confidence, and also to be free of pain and discomfort. The mouth contains millions of bacteria, both the beneficial ones and the bad ones. In the absence of regular mouth care, the number of harmful bacteria proliferate, that is, it multiply, and this can have an effect on the rest of the body, both in the short term and the long run. Oral bacteria are the cause of two most common dental diseases: dental decay and gum diseases. Dental decay is also known as dental caries. It's caused by bacteria metabolizing sugar in the mouth and producing acid that causes cavity in the teeth overnight, while dental decay is linked to the frequency of sugar consumption. Gum disease or periodontal disease generally occurs when ineffective or an absence of tooth brushing, that is poor oral hygiene, tooth brushing, leads to a buildup of bacteria in the mouth, commonly known as plaque. And plaque is a white sticky substance that develops on the teeth and leads to inflammation of gums, which in turn can affect the underlying bones, leading to tooth mobility, teeth loose, or receding gums. Bacteria or toxins produced by bacteria can be absorbed into the bloodstream and travel to other parts of the body. Before I continue, I would like you to take your time to subscribe, hit the notification bell, and share with people and share. I will be discussing oral health and cardiovascular disease. Poor oral care affect cardiovascular diseases because there is strong evidence linking gum disease and heart disease. Oral bacteria can be absorbed into the bloodstream via inflamed gums and travel to other parts of the body. This may contribute to tiny clots or inflammation in the blood vessels that leads to cardiovascular disease. Before I continue, I would like you to please subscribe, hit the notification bell. Thank you. Now I'll be sharing with us on hygiene, endocarditis. Now I'll be sharing with us the relationship between oral care and infective endocarditis. I would like you to pause for a while to subscribe and hit the notification bell. Thank you. Oral health and infective endocarditis. Infective endocarditis may result when bacteria enter the bloodstream of a susceptible individual. For example, somebody with prostatic heart valve and colonizes the lining of the heart, which can lead to inflammation of the lining of the heart valves, and the disease carries a high mortality risk, can be caused by oral bacteria. There is evidence that good oral hygiene reduces the risk. Next, I will be sharing with us oral health and diabetes, the relationship between oral health and diabetes. There is strong evidence of a two-way relationship between oral health and diabetes. Gum disease can lead to poor blood sugar control, and also poorly controlled diabetes can increase the severity of gum disease, which simply means gum disease invariably affects diabetes and diabetes also affect gum disease, vice versa. People with diabetes are also at higher risk of developing oral thrush and dry mouth. Next on my list is oral health and respiratory disease. Before I do so, I will implore us to share, hit the notification bell. Thank you. Oral health and respiratory disease. There is an increasing number of evidence linking poor oral care to community and hospital-acquired pneumonia. The risk of developing pneumonia is higher in patients who are already compromised. For example, those with dysphagia, who are frail, or who are learning disability. Regular and effective mouth care remove bacterial plaque, and oral secretion is recommended as a measure to reduce the risk and severity of pneumonia. Hospital-acquired pneumonia is very common hospital-acquired infection with high morbidity and mortality rates, and extends a hospital admission on average by over a week. If you are not subscribed, I would like us to pause for a while to hit the notification bell and subscribe. Next I'll be sharing with us the relationship between oral care and our general well-being, because there is evidence linking poor oral health to a number of other general health conditions, including stroke, dementia, premature birth, and some types of cancers. However, as this evidence is not as strong, further research is needed. Having a comfortable mouth is important for chewing food. Broken teeth, loose teeth, or a very dry mouth are common reasons that prevent people eating. That is why it is very important to carry out regular mouth care assessment for people who stop eating and drinking. Care should be taken to prevent denture loss, which can have a direct impact on eating. In summary, supporting people with good mouth care and promoting the importance of good oral health can have a positive impact on their general health and well-being. A positive impact on their general health and well-being on the part of the WHO concerning the legal status of any country, territory, city, or area of its authority, or concerning the limitation of the frontier or boundaries agreement. The state of oral health: 1 in 5 children aged 6 to 11 have untreated cavity. while 1 in 4 adults have untreated cavity show signs of gum disease linked to premature birth and low birth weight. 5 tips for good infant dental hygiene. Start early, start small, make it. 5 tips for good infant dental hygiene is to start early, start small, make it a routine, make a dentist appointment, make it a priority. With these 5 tips, every child should. With these 5 tips, good infant hygiene is assured. Most recent evidence brief suggests that dental checkups should be conducted once every 3 years for adults and 1 every 2 years for children. It has been documented that dental professionals frequently advise for more frequent visits, but this advice is contraindicated by evidence suggesting that check-up frequently be based on individual risk factors. Professional cleaning includes tooth scaling, tooth polishing, and this is usually followed by fluoride treatment. Dental sealants, which are applied by dentists to cover and protect features, grooves in the chewing surface of back teeth, preventing food from becoming trapped and thereby halt the decay process. An elastomer strip opposing chewing surface and can also force fluoride toothpaste inside chewing surface to aid in remineralizing or demineralizing teeth. Sources of problems: plaque. Dental plaque, also known as dental biofilm, is a sticky yellow film that appears after tooth surface has been cleaned. Sugar, that is fermentable carbohydrate, is converted into acid by the plaque. If plaque is left on under the gum surface undisturbed, not only is there an increased risk of tooth decay, but it will also go on to irritate the gum and make them appear red and swollen. Some bleeding may be noticed during tooth brushing or flossing. These are the signs of inflammation which indicate poor gum health. Gingivitis. Another problem is calculus. The longer that plaque stays on the tooth surface, the harder and more attached to the teeth it becomes. This is when it is referred to as calculus and the need to remove by a dental professional. If this is not treated, the inflammation will lead to the bone loss and will eventually lead to the affected teeth becoming loosened. Preventive cares. Routine tooth brushing is a principal method of preventing many oral diseases and perhaps the most important activity an individual can practice to reduce plaque build-up. Controlling plaque reduces the risk of the individual suffering from plaque-associated diseases such as gingivitis, periodontitis, and caries. The three most common oral diseases. The average brushing time for individual is about 30 seconds and just over 60 seconds. Many oral health care professionals agree that the tooth brushing should be done for a minimum of 2 minutes and the practice at least twice a day. Brushing for at least 2 minutes per section is optimal for preventing the most common oral disease and removing considerably more plaque than brushing for only 45 seconds. Tooth brushing can only clean the depth of about 1.5 millimeter inside the gingival bucket, but a sustained regime of plaque remain above the gum line can affect the ecology of the microbes below the gums and may reduce the number of pathogens in pockets of about 5 millimeter in depth. Toothpaste with fluoride is an important tool to readily use when tooth brushing. The fluoride in the dentifrice is an important protective factor against caries and an important supplement needed to remineralize already affected enamel. Currently, there is insufficient evidence to evaluate the caries inhibiting characteristics or slow release fluoride glass beads. However, in terms of preventing gum disease, the use of toothpaste does not increase the effectiveness of the activity with respect to the amount of plaque removed. People use toothpaste with nano-hydroxyl apatite instead of fluoride as it performs the same function. Some people believe fluoride in toothpaste is a neurotoxin. The modern manual toothbrush is a dental tool which consists of head of nylon bristle attached to a long handle to help facilitate the manual action of toothbrushing. Electric toothbrush. Electric toothbrush are toothbrush with moving or vibrating bristle head. The two main types of electric toothbrushes are the sonic type, which has a vibrating head, and the oscillating rotating type, in which the bristle head moves constant clockwise and anti-clockwise movement. Electric toothbrush are more expensive than the manual toothbrush and more damaging to the environment. Flossing. Toothbrushing alone will not remove plaque from all surfaces of the mouth, as 40% of the surface are interdental. One technique that can be used to assess this area is dental floss. When the proper technique is used, flossing can remove plaque and food particles between the teeth and below the gums. Types of floss include: 1. On-wax floss, unbound nylon filament that spread across the tooth. Plaque and debris get trapped for easy removal. 2. Wax floss, less susceptible to tearing or shredding when used between tight contacts or area with overhanging restoration. 3. Polytetrafluoroethylene, also known as Teflon, slide easily through tight contacts and does not fray. The type of floss used is a personal preference. However, without proper techniques, it may not be effective. The correct techniques to ensure maximum plaque removal is as follows. Interdental brushes. Interdental brushes comes in a range of color-coded size. They consist of handle with the pieces of wire covered in tapered bristles. They are designed to be placed into the interdental space for plaque removal. The tongue contains numerous bacteria which causes bad breath. Tongue cleaners are designed to remove debris built up on the tongue. Using a toothbrush to clean the tongue is another possibility. However, it may be hard to reach the back of the tongue, and the bristle of the toothbrush may be too soft to remove the debris. Steps of using the tongue scraper. Oral irrigation is another form of cleansing. Some dental professionals recommended some gingival irrigation, also known as water flossing, as a way to clean teeth and gums. Oral irrigator may be used instead of or in addition to flossing. Single tuft brushes is another method of cleansing. Then gum stimulators. Toothbrush with pointed rubber tips at the ends of the hands have been available for many years and have more recently been replaced by a tool called gum stimulator, designed to massage the gum line and the bases of the area between the teeth. Such stimulator helps to increase circulation to the gum line and to clear away bacteria which might not be removed by brushing or flossing alone. Food and drinks. Foods that helps muscle and bone also helps teeth and gum. Vitamin C is necessary, for example, to prevent scurvy, which manifests as serious gum disease. Eating a balanced diet and limiting sugar intake can help prevent tooth decay and periodontal disease. Community water fluoridation is the addition of fluoride to adjust the natural fluoride concentration of community water supply to the level recommended for optimal dental health, approximately 1 part per million. Fluoride is a primary protector against dental cavities. Fluoride makes the surface of teeth more resistant to acid during the process of remineralization. Drinking fluorinated water is recommended by some dental professionals, which others say that using toothpaste alone is enough. Second beneficial class of food is milk, cheese, nuts, chicken are also rich in calcium and phosphate and may also encourage remineralization. The third group, the body can't absorb all the required calcium if it lacks vitamin D. So fatty fish, for example salmon, for instance, as a major source of vitamin D, helps your teeth and gums to get more benefit of calcium. Green and black tea, which is richly endowed with polyphenol, act as a suppressor of the bacteria that can cause plaque. Therefore, it helps in sustaining oral health and is advisable during or after meal. Finally, food high in fiber like vegetables may also help to increase the flow of saliva, and a bolus of fiber like cereal, string, fresh carrots, broccoli can force saliva into trapped food inside teeth and features on chewing surface where over 80% of cavities occur. To dilute carbohydrates like sugar, neutralize acid and remineralize teeth on easy to reach surface. Harmful foods. Sugar are commonly associated with dental cavity. Other carbohydrates, especially cooked starches, example potato chips, may also damage teeth, although to a lesser degree and indirectly, since starch has to be converted into glucose by salivary amylase and enzymes into the saliva. Harmful food. Sugars are commonly associated with dental cavity. Other carbohydrates, especially cooked starches, example potato chips, may also damage teeth, although to a lesser degree and indirectly, since starch has to be converted to glucose by salivary amylase and enzyme inside the saliva. Sugars in food that are more sticky, such as toffee, are likely to cause more damage to the teeth than those in less sticky food, such as certain food of chocolate or most fruits. Another harmful food is sucrose. Table sugar is most commonly associated with cavity. The amount of sugar consumed at any one time is less important than how often food and drinks that contain sugar are consumed. The more frequent sugars are consumed, the greater the time during which the tooth is exposed to low pH level, at which point demineralization occurs, that is between 5.5 for most people. It is important therefore to try to encourage infrequent consumption of food and drinks containing sugar so that the teeth have a chance to repair by remineralization and fluoride. Acid contained in fruit juice, vinegar, soft drinks lower the pH level of oral cavity, which causes the enema to demineralize. Drinking drinks such as orange juice, cola, acid contained in fruit juice, vinegar and soft drinks lower the pH of the oral cavity, which causes the enema to demineralize. Drinking drinks such as orange juice or cola throughout the day raises the risk of dental cavity. Another factor which affects the risk of developing cavity is stickiness of food. Some food or sweets may stick to the teeth and so reduce the pH of the mouth for an extended time, particularly if they are sugary. It is important that teeth be cleaned at least twice a day, preferably with toothbrush and fluoride to remove any food sticking to the teeth. Regular brushing and the use of dental floss also remove the dental plaque coating the tooth surface. Chewing gum assists oral irrigation between and around the teeth, cleaning and remove particles, but for teeth in poor condition it may damage or remove to loose filling as well. Dental chewing gum claim to improve dental health. Sugar-free chewing gum stimulates saliva production and helps to clean the surface of the teeth. Chewing on solid objects such as ice cap can chips teeth, leading to further tooth fracture. Food with no nutritional value. Alcohol, drinking dark colored beverages such as wine, beer may stain teeth, leading to a discolored smile. Drinking high concentrated alcohol can lead to dry mouth with little saliva to protect the teeth from plague and bacteria. Smoking is one of the leading risk factors associated with periodontal disease. It is thought that smoking impairs and alters normal immune responses, eliciting destructive processes while inhibiting reparative responses, promoting the incidence and development of periodontal disease. Regular vomiting as seen in bulimia nervosa and motion sickness also cause significant damage due to acid erosion. I want us to pause for a while to subscribe, hit the notification bell so that each time we release any new video, you'll be getting mouthwash. There are three commonly used kind of mouthwashes: saline, which is salty water, essential oil or breath, and the third one is chlorhexidine gluconate, for example hexidine. Saline, warm salty water, is usually recommended after procedure like dental extraction. In a study completed in 2014, warm saline mouth rinse was compared to to no mouth rinse in preventing alveolar osteitis, that is dry socket, after extraction. In the group that was instructed to rinse with saline, the prevalence of alveolar osteitis was less than the group that did not. Essential oil found in Listerine or Brett's mouthwash contain eucalyptus, menthol, tamol, methyl salicylate. CPC containing mouthwash contain cetyl pyridine chloride found in brands such as Colgate Plex, Crest, Oral-B, and so many of them. Essential oil and CPC mouthwash or mouth rinse were compared. It was found that plaque and gingivitis level were lower with essential oil mouth rinse when used as an adjunct to mechanical plaque remover, that is toothbrushing and interdental cleaning. Chlorhexidine. Thank you for watching. Please pause for a moment to subscribe, hit the notification bell and share. Thank you. Chlorhexidine gluconate is an antiseptic mouth rinse that should only be used in 2-week time period due to a brown staining on the teeth and tongue. Compared to the essential oil, it is more efficacious in controlling plaque level but has no better effect on gingivitis and is therefore generally used for post-surgical wound healing or short-time control of plaque. Sodium hypochlorite is a common household bleach. Can be used as a 0.2% solution for 30 seconds 2 to 3 times a week as a cheap and effective means of combating harmful bacteria. The commercial product is 5% or 6%, so this requires diluting the product by a factor of 30, that is half teaspoon in a full glass of water. The solution will lose activity with time and be discarded after 1 day. I want also pause for a while to subscribe, hit the notification bell so that each time we release any new video you'll be getting informed and notified. Appliance care. Denture must be kept extremely clean. It is recommended that denture be cleaned mechanically twice a day with a soft brittle brushes and denture cleaning paste. It is not recommended to use toothpaste as it is too abrasive or for acrylic and will leave plaque retaining scratches in the surface. Retainer. As with denture, it is recommended to clean retainer probably at least once a day, avoiding toothpaste and using soap, and to soak them overnight with alkaline peroxide denture cleansing tablet once a week. Hot temperature will warp the shape of the retainer, therefore rinsing under cool water is preferred. Keeping the retainer in a plastic case and rinsing it before and considered to help reduce the number of bacteria being transferred back into the mouth. Thank you for watching. Please pause for a moment to subscribe, hit the notification bell and share. Thank you. Braces. While undertaking the braces treatment, it is recommended to use a small size or specialized toothbrush with soft head to access hard to reach area. Brushing after every meal is highly advisable. Using a high fluoride toothpaste during treatment can be more effective than using a normal toothpaste. Also, regular flossing is as important as brushing and helps to remove any plaque build up, as well as smaller food particles that are stuck in your brace or between your teeth. I want also pause for a while to subscribe, hit the notification bell so that each time we release any new video you'll be getting informed and notified. Education. To become a dentist hygienist, oral hygiene and systemic disease. Several recent clinical studies suggest oral disease and inflammation may be at risk for serious systemic disease such as cardiovascular disease, that's heart attack or stroke, bacterial pneumonia, low birth weight, diabetes complication, osteoporosis, and I will be discussing oral health and several systemic disease that is implicated in a short while. But before I do so, here are the following tips for good oral health care. Brushing of the mouth twice a day, that is morning and when you're going to bed. Flush daily. Rinse your mouth with good mouthwashes. Then also chew sugar-free gums. Kindly do subscribe and hit the notification bell. Thank you. Regular oral care is the key, like toothbrushing and periodically visiting your dentist. Some of these pictures depict what the dentist is doing for routine check during routine dental visits. Finally, I'll be leaving us with dental checkup chart, which includes checkup for the following over a period of time: tooth decay, gum disease, oral disease, and oral cancer. Kindly do subscribe and hit the notification bell. Thank you.